I had bilingual staff certainly, but also had people from the American Indian community to represent, as well as African American, of course. So we tried to make sure we diversified, and even had some temporary people from the Hmong community did some work.
But then you tried to get that to happen in the other departments too.
Absolutely, yeah. We definitely saw some of that because it was so important that the leadership at the top was holding everybody accountable, and so they were actually reporting to us their progress, and so it was a good run. Mm-hmm. And you know how that goes. When the leadership changes, yeah.
And so, what was that? What happened when the leadership changes? I mean,
honestly, literally, I was the Office of Minority Health, then moved back into the Division of Public Health. So
this was a leadership change at the State Health Department?
Yes, yes. So, that was the whole thing, So positioning, it definitely makes a difference in terms of being able to influence what's going on internally, But we always were able to do the work out in the community, but,
But no longer having the same influence in the State Health Department?
Not once we moved back to
and that was
Division of
after
Public
Carmen
Health.
Hooker Odom?
Yes. The politics of it all, right? It is what it is.
Well, it's democracy.
It is.
That's people, exactly. And the people take over, and different people take over, and
yes,
things happen.
And things change.
Do you want to talk about your exit from the department, or?
No, not really.
Okay.
But the only thing I'll say is that my career was amazing. It was exactly a perfect fit for the things that I'm about, and that is I was in position to influence policy. I was in position to help build the capacity of people out in the community, and I was in position to invest resources in the people who were experiencing the disparities. So absolutely no regrets. I had an amazing career. 27 years in, I think that's pretty good.
Well, a lot of us were very excited about the work you were doing and having you in that position.
Well, thank you. Thank you.
So, I'm wondering, was the Minority Health Conference on your radar, the UNC Minority Health Conference on your radar while you were in the Office of Minority Health and Health Disparities? And can you say something about
Oh, wow. That? Absolutely. I don't know how I missed that.
No, you didn't miss it. I forgot.
No, that's okay. Oh, no. We were definitely participants. I was really excited the year I was asked to be the moderator for the day for the Minority Health Conference.
Now, you're thinking of the broadcast.
Yes.
But I was asking you actually about the conference that you worked on when you were a student.
Oh,
the one that the students organized.
Oh, okay.
Thank you.
Okay.
I forgot that. We want to talk about that
too. Okay. Yes. So, yeah, definitely. We were participants, and always made sure that the people, some of the partners from the community, had a chance to come and to experience that as well, that information, and just to stay on top of it, because one of the things about the conference, the Minority Health Conference, was that it was always bringing you up to date, current information, current issues, some of the hot topics that everybody needed to be aware of. So yes.
And your office was often a sponsor or co-sponsor of the conference.
Yes, that's exactly right.
Is there anything else you might want to say about that? I'm thinking that the Minority Health Conference organizers will probably see this interview. And anything that might help to give them both inspiration and or reinforcement for what they're doing. If you think of anything at some point you want to throw that out, feel free to.
The only thing that I would say is the beauty of that conference in the early years was that it clearly had a strong community focus, and it had a strong connection to getting people outreach to the community. So I hope that that's not lost. That's all I'd say. Is if you can't hear from it's good to hear it should be a balance. It's certainly good to hear from the researchers from that perspective, but nothing is better than people from the community telling their own story. Nothing.
Mm-hmm.
Yeah.
So now let's talk about what used to be called the Summer Public Health Research Video Conference on Minority Health, and is now called the National Health Equity Research Webcast. What importance has that had? And you were a moderator in it,
Yes.
one of our most exciting years.
Yeah. Well, what I love about it is it's the reach, and it's where you could participate in that and learn again about the latest in the research and helping us to understand, are we really moving the needle, and if not, what are some new approaches that we maybe should try. So I think the information is always very helpful in terms of people who want to understand, okay, well, maybe this is an area I need to focus on, or this is a policy for elected officials, certainly need to be a part of those more. So that would be the other group that I would say, to make sure that there is an intentional effort to reach out to people who can really influence policy and make the changes. Otherwise, it's, you want to make sure that it's more than just a great conversation.
So what was it like being a moderator?
Scary. Oh my gosh. I was so intimidated. Oh my gosh. Because I had to just not focus on the fact that this is like global. And so it was a fun day, and it was a great conversation. So but yeah, it was a great experience, but I was a little nervous about it.
Mm-hmm. Naturally. Would you, did it do anything for you in terms of your own career or your own recognition or anything?
Well, it definitely gave me confidence that I could do it, because that was a first. So yeah, now I'm ready. No, I'm just kidding. But it was fun.
Well, no,
it was fun.
You weren't ready.
It was fun.
And you were also, there was an association of directors of minority health, offices of minority health.
Yes, the National Association of State Offices of Minority Health, and I served as president for that association, and that was also an interesting experience because it helped me to really appreciate how much support I really did have in the state of North Carolina. Because, Vic, I'm telling you, I would talk to directors in other states, and boy, they didn't have the support, the resources, they didn't have a whole lot going on, and so that made me feel really proud in North Carolina.
And what was that state association able to do anything as well besides just reinforce? I mean, did it try to influence national policy, for example?
And I'm glad you mentioned that, because the National Office of Minority Health actually put together, it was a health disparities plan, a national plan, and so the state offices of minority health directors were very instrumental in giving feedback and input in developing that national plan. And that was such a fun experience, because you got to hear the best of what was working in various states and what was not working in various states, and to put it together in a document that can literally guide the nation for years. And so yeah, that plan is still out there. Yeah.
So when we were talking earlier, I asked you about Bill Jenkins and how you met him. And I wondered if you would anything you'd like to say about Bill or any of our other public health heroes from UNC or elsewhere, of course. But anybody that you met, I don't know where you met Bill.
I actually met Bill in Chapel Hill through Dr. Laurie Carter-Edwards, and I don't remember the event, but I do remember having conversations with Bill. And then a few years later, I guess a lot of years later, when I was teaching an ethics course at St. Augustine's University, because I'm an adjunct professor in public health, and I was teaching an ethics course, and we were studying the issue of eugenics, and I found a video of Bill talking about, no, it wasn't eugenics. Well, yeah, I think it was eugenics, but anyway, he was talking about the Tuskegee, right? But we were talking. That's what it was. We were talking about um, examples of how the systems had failed populations of color, and so in different populations. So I remember seeing the video in which Bill was talking about the Tuskegee study, and I was like, "There's Bill Jenkins," and then I called him. I was like, "Bill, I didn't know you were doing some of that early work," but that's when he was at CDC.
Yeah, that would have been the, trying to think which one that was, because you know he made a video, but he's not in the video that he produced.
It was him interviewed. That's when he was a young Bill Jenkins.
Yes, I found that one online.
Yes.
I have a link to it in the Bill Jenkins film.
So I was sharing that with our students. Yeah. It's like, I know this guy.
Any of our other school public health heroes or heroines whom you want to mention?
Well,
then I want to turn to what you did after you left.
Oh, sure, yeah. Sure, and we've certainly talked about Dr. John Hatch, but I also have to acknowledge Dr. Jeannie Ng, because one of the things that I appreciated about her is she was out there with us in the community, and just her ability to relate to diverse populations and was so comfortable. It just always was so cool. So I definitely would like to acknowledge her support over the years for sure. Yeah.
And Laurie Carter Edwards, how did you know Laurie? She was happy.
Yeah, Dr. Laurie Carter Edwards and I, we were in a meeting. I can't even remember now. Was it with Medicare? It was something to do with Medicare. And anyway, we connected, and Dr. Laurie Carter Edwards, I call her my researcher really, because she helped us with so many of our initiatives. She helped us with the Community Empowerment Network, and that she helped us to develop tools that we could give to the faith leaders, because we were training faith leaders to be health advocates from the pulpit. And then with our Community Health Ambassador program, she was the one that helped us to develop the tools, the toolkit. She helped us to put together the toolkit for community health ambassadors, in which it included the assessment and the tracking tools for when they went out to talk with people in their communities. We had a way to document their work, and so we could actually track, and that's how we were able to see what changes, because they did, blood pressures, they did weight, and all of those kinds of things. So Laurie actually was there to help us with all of those things. So she really has been instrumental in supporting the work. She and I co-authored a book chapter after a few years ago that was talking about some of our work in terms of engaging faith leaders in health. So.
And were you working with Shaw also? Shaw University?
I'm trying to remember. I know she did a lot of work with when they had the Health Disparities Initiative going on there. We probably did a little bit there with the office, but not a whole lot, because they were mainly doing some work with local churches. Yeah.
So after you left the Office of Minority Health and Health Disparities, what have you been working on?
Oh, wow.
Or doing?
Wow. It's amazing how, because I told you I had 27 years in, I took early retirement from the state and just had a chance to reinvent myself. So that's been amazing. That was in 2012, to date myself, 7 years ago now. And so I've had a chance to continue some of the work. I love working with nonprofits. I'm always going to support nonprofits. So I've been working as a consultant with them, again, helping to do some of the same things I was doing with the office, and that is helping them with organizational development, leadership development, helping them with grant writing, helping them also just to learn how to document their story. Because a lot of nonprofits do the work, but it's in their head. And just teaching them that you have to write it. If it's not written, it didn't really happen. So you gotta do that. And so I've been doing some of that work. Entrepreneur, started doing, learned about how you can have fun traveling and saving money, and been doing that. And then an adjunct professor at St. Augustine's University, and that's with an undergraduate public health program that really is only about 7 years old.
So tell me more about that.
Yeah.
I mean, this is like you went through an undergraduate public health program and now you've helped to create one?
I won't say create it, but I'm helping to build it, I guess, support.
Mm-hmm.
So the undergraduate program, like I said, it started, I think it's in about 2012, and it's undergraduate, and it really is I think the real focus is training this next generation of students to work in communities and do basic community health work. And it's I guess the only other thing, I coordinate their internship program. So one of the requirements for graduation is that the students have to complete 225 hours in field work. And so that's the Ethel Jackson coming back. And so I love that part because they have to be in real world experiences, and so I coordinate that internship program and help them to find preceptors and placement sites so that they can have that experience by their senior year. So I've been doing that now for about 3 years. Yeah. So
and
that's fun.
When you're working as a consultant, doing some of the same things you did from the office, can you compare what is that similar work, but in two different framework? I mean, you don't have a boss, which is very different. You're not having these annual reviews and things. On the other hand, I don't know what whether you're getting paid and things. Anything you want to throw out for other people who might think about becoming a consultant?
I love the freedom of it and the flexibility of it, to be honest with you. And the beautiful thing is you get to pick and choose the organization you want to work with, the grants you want to help them write or whatever. So the flexibility is just amazing. And it is a part of my give back. With some of them, they may not have the resources. With some, they may have limited resources to compensate my time or whatever. Or they don't even do that. They might give me a little bit of a stipend or something. But for me, it's the work, and it's knowing that when they succeed, it helps to bridge some gaps for people in the community who don't quite know how to get access to the resources they need. But this nonprofit really is, I think, such a connector that's why I support that work.
And how do you get, is it just word of mouth?
Word of mouth.
People know about you?
Absolutely. I have never had to try to find any work. I turned down a lot because I'm like, no, but that's a good thing. But once I left the state, some of the nonprofits I had worked with in the past said, oh, you used to give grants, now how about helping us to write some? So that's how I got started.
Right, of course.
That's how I got started. So I said, okay, I can do that. So it's been fun. That's been fun.
So what about your travel business?
Oh, wow, that's been amazing. So I've been a part of that for 7 years as well. And so literally showing people how to travel and save money and have fun. And if you're open to something into a very unique way, you can actually generate a real nice stream of income as well. So I've been doing that too. Like I said, I'm an entrepreneur.
Yes.
And had to get out the comfort zone though, because I'm a well-trained employee. I was a well-trained employee. I've been doing it a long time. That was the whole thing. You do well, you make the system look good. But now I figure I can work as hard for myself, and so I do that. Yeah. So anybody open to looking for 2020 to be a different year? Absolutely. Talk to me.
Okay. And lastly, I guess, unless there's anything else you want to bring up, what about the story of your book?
Wow. So okay, that thank you for bringing that up, and I think this is a good place to kind of wrap up on. So living my life, traveling, just having an amazing time, and then that was from 2012, and then in 2015 I was diagnosed with breast cancer. And the message that I definitely want to put out there, because I'm still a health educator by training and from the heart. So had my regular mammogram in October of 2014, and by June 2015, I'm doing my breast self-exam, and I felt something that didn't feel normal. Not that it felt like a lump or anything, it just felt like something extra there that was not there before. Waited a few days, say it's probably hormones. You know, I wanted to rationalize it away, and it didn't go away. So I said, I think I better go get it checked out. When I went to my primary care doctor, she examined me immediately, sent me for a diagnostic mammogram, and that just kind of took my world into a nosedive, into the other side of the system. I thought I knew something about the healthcare system. I didn't know anything that I thought I knew. Being a patient and just seeing and experiencing the healthcare system from the other side, quite an eye-opener, and not a good thing, but made it through. So because I'd had some training and education in terms of health, I could follow what the doctors were saying a little bit more than the average person perhaps. And because I had worked for the American Cancer Society, I knew a little more than probably the average person, so I knew the questions to ask and those kinds of things. But quite an eye-opening experience, and I'm just grateful I was able to get through that. And so out of that experience, I ended up journaling the experience on the days when I felt like writing, and that was on the recommendation of a girlfriend. You got to journal, you got to write your story, Barbara, because you're going to have to help other women. And I'm thinking, I just got diagnosed. I don't want to hear that. But I did journal, and I'm glad I did. And out of that, I wrote expressions. And so my book is The New Woman in the Mirror, and it's based on my experience from the diagnosis to healing. And out of the journal, I wrote what I call expressions. I don't call them poems. There are some poems mixed in, but it's just my story of how I got through that tough challenge. 2015, 2016 was quite a tough year, but I made it through it. I'm grateful, and I thank God for that I'm here. And The New Woman in the Mirror also includes prompt questions after my expressions so that the reader can write their own story. Because for me, my story was a major part. Writing it out was such healing. Oh my gosh, Vic. I got it out. I didn't have to feel it anymore. I wrote it down. And so I'm praying that the book will help other people going through whatever. Mine just happens to be cancer. It could be anything that you're going through that's been a hard place in your life. You can write your own story along with me, and I promise you it'll help you to heal. Yeah, so that's The New Woman in the Mirror. And to get a copy, you can go to my website, barbarapullen-smith.com. Just that simple.
No hyphen?
Nope, barbarapullen-smith.com. That's right, no hyphen.
Any last thoughts you want to get out?
Well, no, I think that right now I'm just enjoying living life. And after going through the ordeal with the cancer, I've certainly had an opportunity now to reach out to a lot of other people newly diagnosed, and can share my story of hope and encouragement. And the book has really helped a lot of people, and it's been a blessing because now people are buying the book for other people. They've read it and they say, oh wow, I know somebody. So that's been really going well. And so that's just a new part of what I do, is now to help other people fight it, because it's a fight. And I tell people it's one of the hardest fights I've ever been in my life, but it's a fight, and it's a fight you can win if you just partner up with the healthcare system to follow the treatments, to do what they say do, and work as a team. And the value of family support, I have to say that too, because I thank God for my husband and our sons and my family. for just being there, and just the church support and friends, just a network of people who made sure we had food, who literally drove me to treatments and gave Keith a break so that he could go to work. It does take a whole community to help people get through those fights, regardless of what the health issue is. So I hope that for people who, folks who are going through, just show up, because they may not ever know what to ask for, but they need you just to get through that. So, yeah.
Great. Well, thank you. That's wonderful.
Wow.
And, I really appreciate you.
Thank you, Vic. This has been amazing. Thank you for just giving me the opportunity. How cool. I really appreciate it.